Welcome to this week's edition of Public Health Updates, covering the latest breakthroughs. Brought to you by Lucid Quest. Mattel's newest Barbie now reflects real-life experiences of type 1 diabetes. Developed in collaboration with Breakthrough T1D, the doll features a continuous glucose monitor, insulin pump, diabetes management app on a phone, and a medical supply bag. The initiative honors public figures Robin Arzon and Lila Moss, both living with type 1 diabetes. The goal: to promote inclusion, empathy, and awareness through play. Penn State researchers have secured a $1.2 million grant from the W.M. Keck Foundation to study the neuroscience of nightmares. Using mice and the medication mefloquine, they are modeling dream disturbances. The focus is on brain regions, including the amygdala and prefrontal cortex. The long-term aim is to better understand links to PTSD and develop predictive tools for mental health diagnostics. In the United Kingdom, the first babies have been born with DNA from 3 people, thanks to a groundbreaking technique to prevent fatal mitochondrial diseases. Developed at Newcastle University, the approach uses 99.9% DNA from the parents and 0.1% from a donor. Legal since 2015, the procedure is now being successfully implemented, with up to 30 cases expected per year. Digital health platform Numan has raised $60 million to expand its services. The funding includes $30 million in equity and $27 million in growth capital, led by Big Pie Ventures and HSBC. Numan currently focuses on men's health, AI-driven symptom checking, diagnostics, and behavioral coaching. The new capital will support entry into women's health and broader preventive care. According to the World Health Organization and UNICEF, 14 million children missed routine vaccinations in 2024. 9 countries accounted for over half of these missed cases. The report cites stagnating global vaccine coverage driven by misinformation and funding shortages. The United States is facing its worst measles outbreak in over 30 years, while the UK reported a measles death in Liverpool. WHO warns that immediate coordinated action is critical to preserve immunization progress. A major Danish study published in the Annals of Internal Medicine has confirmed vaccine safety with respect to aluminum content. Following 1.2 million children, the study found no evidence of increased risk for autism, ADHD, or autoimmune conditions. Reported hazard ratios were 0.93 for autism, 0.90 for ADHD, and 0.98 for autoimmune disease. The findings underscore that aluminum exposure through vaccines remains minimal and safe. New research from McMaster University links high consumption of ultra-processed foods to a range of serious health risks. These include inflammation, insulin resistance, and metabolic disorders. Additional studies associate UPF intake with depression, anxiety, and reduced sperm count. Experts are calling for a shift toward whole, home-cooked meals to mitigate these risks. Duke and Vanderbilt University medical centers have developed promising new technologies to expand infant heart transplants. At Duke, a simplified oxygenation method was used to successfully transplant a heart from a donor after circulatory death. Vanderbilt utilized a cold preservation solution, enabling 25 successful infant transplants. These techniques could significantly increase the availability of donor hearts for infants. A study from the University of Bristol, published in the Journal of Parkinson's Disease, has demonstrated that dogs can detect Parkinson's disease years before symptoms appear. Using skin swabs, trained dogs achieved 98% specificity. This could pave the way for non-invasive, low-cost screening tools for early detection. Finally, a study in PLOS biology reveals that playing music may keep the brain younger. Musicians outperformed non-musicians in auditory tasks, particularly in noisy environments. Brain imaging showed patterns resembling those of younger adults. The findings support the role of musical activity as a powerful tool for preserving cognitive function over time. Stay ahead in public health research. Like, share, and subscribe for weekly updates. Visit lqventures.com or email us at info@lqventures.com for